I was born with congenitally missing teeth. So I had baby teeth, and when I was around, 12 or 13 years old, they said, you don't have any mature teeth. So I started this process of getting braces to hold the spaces open, and then they decided the best path forward at that time was to put bridges in. So they put Maryland bridges in, and those held up for a certain period of time, and then at a certain period of time they failed. So then I had these inlay bridges put in next, and then the inlay bridge started to fail on one side of my mouth. So I started to get and feel a little frustrated and said, what can I do next? So I met with various doctors in New England before I met Dr. Toback. Most of them said to me, you have a very low sinus. And that's just like your sinus cavity up here was just really coming down very low. And it would be a very difficult surgery to raise that up in order to get bone in there, to create a bone, because I didn't have enough bone either, to then get an implant. So it was a little bit complicated. It wasn't just like, could I get an implant? So I met with various doctors, and most of them said to me, it's going to be tricky, it's going to be difficult. And so probably your best path forward was to get a 3-crown bridge. And just hearing the word bridge again was like, I don't really want to do that one more time. So I had just moved to Connecticut, and I met with this dentist I had just started going to, and he said, why don't you go see Dr. Toback?
So Tracy arrived with a rather skeptical question of whether she could have dental implants. She had received a consultation in another surgeon's office and was told that she couldn't have implants. Her dentist had advised her to come see me and see if there was a way that we could possibly perform her case. Tracy required some complex bone grafting procedures in her sinuses, but was well within the technology that we have available to be able to provide her with dental implants and ultimately tooth replacement.
So I stepped into the room, and Dr. Toback came striding in, and he seemed very confident, very excited about meeting me and wanted to talk to me about what my problems were. And I said, well, I think I can hopefully get an implant on my lower jaw because the doctors had indicated I had enough bone here. And he said to me, well, why aren't you pursuing implants on your upper mouth? And I said, well, I was told I have a really big sinus lift that would have to happen. It'd be tricky surgery, it'd be maybe too difficult. And he just kind of snickered, and he said, it's a walk in the park. And the other lady looked at me and she goes, oh, he does it all the time. He does it every single day.
I think one of the fun parts of working with Tracy is for many patients, when the answer seems to be no, the real answer is how. How can we do the case? How can we get the patient the results that they want? And we were able to do that for Tracy. She healed terrifically well from her bone grafts. We proceeded to place dental implants, and ultimately her dentist did a fantastic job in making the final restorations. And Tracy is doing just terrific, and she loves her dental implants.
I thought it was going to be a pretty big ordeal, and at the end of the day it ended up being really relatively simple. It's just psychologically having gaps in your mouth is not a good feeling, so getting it taken care of is really nice.